Anyone who's, survived medical training knows the feeling. The sheer volume of information is just, it's absolutely crushing.
Oh, it's overwhelming. And sometimes the thing that actually saves you on rounds isn't a textbook, it's a meme.
Exactly. A really specific, weirdly accurate visual mnemonic.
And that's what we're strubbing in on today. We're not just looking at jokes, we're analyzing the science behind 5 key medical memes. These are basically life-saving shortcuts.
We're taking a tour of the body's internal drama. We've got biochemical betrayal, structural problems, the physics of laziness.
And my favorite, the terrifying efficiency of the immune system's cellular memory.
Okay, let's jump in. Our first stop is this meme that I'd call the textbook visual pun. It's just a weeping stone statue.
Right, and this tragically refers to Fibrodyplasia ossificans progressiva, or FOP, it's got that awful nickname, Stone Man syndrome.
And the pathology itself is, well, it's just so ironic.
It really is. The body's most basic mechanism for repair is what causes the breakdown. When you damage soft tissue, like a muscle, the repair pathway it goes rogue.
So instead of healing the muscle, it replaces it with bone.
Exactly, a process called ossification. The patient's body literally starts growing a second skeleton, locking all the joints in place. It's a complete betrayal structure.
Wow. Okay, so from structural betrayal to what about biochemical betrayal? That brings us to meme number 2, the classic distracted boyfriend.
Yes. A masterpiece of cellular drama. So normally you have procalcitonin, he's the boyfriend, made in the thyroid, and he's immediately cleaved into calcitonin, the girlfriend.
A perfect, stable couple. Their job is regulating calcium, and procalcitonin levels stay super low.
But then, along comes bacterial sepsis, the distraction.
The infection floods the body with these inflammatory molecules, cytokines like IL-6 and TNF-alpha. They're like chemical fire alarms going off everywhere.
And those alarms scream at tissues all over the body to just mass-produce procalcitonin.
And procalcitonin, our boyfriend, totally forgets his job. He never turns into calcitonin.
Completely ignores her. His levels in the blood just skyrocket.
Yeah.
Which, clinically, is actually pretty useful for us.
Right, that's the key takeaway. This infidelity tells us something important.
It's a huge biomarker. When you see those high procalcitonin levels, you know the inflammation is very likely from a bacterial infection, and you can ramp up the sepsis protocol immediately.
Okay, let's switch gears from chemistry to physics. Meme 3. Shunting, visualized as the left exit 12 off-ramp.
I love this one. So think of the highway as the capillary bed. That's the destination, the high-resistance job site, where oxygen is supposed to get offloaded to the tissues.
But the off-ramp is the shunt. It's the shortcut that bypasses the capillaries completely.
And this is all about the fundamental laziness of blood. Blood will always, always follow the path of least resistance. High pressure to low pressure.
So if there's a shortcut, like a hole in the heart or some other fistula,
the blood takes the exit, it takes the off-ramp.
But if the blood is taking the easy route, is that always a bad thing? I mean, how does the body handle that?
Well, in this context, it's usually catastrophic. Too much blood takes that shortcut, and the tissues get starved of oxygen. That leads to hypoxia or even high-output heart failure because you're just pumping blood around in a useless loop.
A very inefficient commute.
The worst.
All right, now for what you called your favorite. The terrifying efficiency of the memory T cell. Meme 4, the anamnestic stare.
This is just so cool. It's the difference between a rookie and a veteran. A naive T cell, the rookie, sees an infection for the first time and needs days, maybe weeks, for a clonal expansion.
A lot of bureaucratic red tape in the immune system.
A ton. But the memory T cell is a veteran. It's been patrolling, waiting. It has a much lower activation threshold. It just skips the red tape.
So it proliferates instantly.
Instantly, and unleashes this massive wave of cytokines. It's the ultimate biological grudge. Gets the job done so fast you often don't even know you were infected.
And that's exactly what vaccines are designed to do, right? Create an army of these angry veterans.
Precisely. They're ready to strike the second that familiar enemy shows up.
Okay, finally, meme 5. A personal favorite. The immunoglobulin isotypes, laid out on the Doge scale of strength.
I genuinely wish I had this when I was studying immunology. It's perfect.
Yeah.
So you have your monomers, the single buff Doges, that's IgG, the workhorse that crosses the placenta, and IgE for allergies.
Then you've got IgA, the dimer.
Ouch.
2 buff Doges held together, found in secretions.
And the big one, IgM, is the pentamer. 5 buff Doges in a star. It's the massive first responder, great for clumping invaders together.
Which brings us to the punchline. Poor IgD.
Poor IgD is Cheems, the weak Doge. It's a monomer, yeah, but it's just clinically underwhelming. It mostly just sits on B cells, not doing much.
It really is amazing how these simple templates capture so much complex drama, from lazy blood flow to the immune system's terrifying memory.
They really do. They're incredible learning tools.
It makes you wonder, though, if you think about the sheer efficiency of that memory T cell, what other hidden physiological mechanism is inside your body right now, just preparing for a second, faster strike?
That's a great thought to leave people with. And if you found these shortcuts helpful for navigating the information overload, make sure you subscribe to the BodyTalks Medicine podcast for more of these deep dives.